Hey, Dr. Patel.
Hey, Dr. Mora, how are you?
I'm doing all right. How are you doing?
Doing well.
Good, good, good. So we wanted to talk today about some of the testing that we do and one of our favorite tests, the GI map. So
Great
talk to me
test.
about, yeah, great test. We use it all the time. What is the GI map?
Yeah, great question. The GI map is an at-home stool profile.
Hmm.
One sample, fun times, but we get a nice snapshot of one's microbiome.
Yep. Yeah, really teeny tiny
Mhm.
amount of stool. So it's not a 3-day collection. It's not super involved. So we get a lot of
Yep.
information. And who are we using this for? So we're getting a lot of patients who are coming into us with, these sort of like non-specific symptoms like, gas and bloating, reflux, constipation, abdominal pain, but then also the
Mhm.
more systemic issues like skin issues like rashes, acne, mood changes, joint pain, autoimmune. So we're really using it for a lot of different people. It gives us a lens into kind of how the entire system is responding and working. So,
Yep. And
um,
I same thing. I use it for a variety of different conditions, not just GI,
yep.
but systemic also.
Yeah, and a lot for our patients who come to us because they're not getting answers from their gastroenterologist, right? They've done colonoscopy, endoscopy, and
Hmm.
everything's normal, and yet they still feel horrible. And so this is kind of our next step in a lot of ways.
Correct. And it's just a lot more in depth, in
Yeah.
my opinion, than what you would get with traditional gastro.
Yep.
But maybe we can look at a sample report and
Yeah.
kind of walk somebody through it and just get a
Yeah.
snapshot.
Yeah. Let's look at this. So this is a sample report from the lab. Um, I'm a sample. That's the name of the patient. And we're going to walk through some of these markers. So talk to me about this first page. So this first page is your acute pathogens, right?
Hmm.
We don't see
Yeah.
people coming up positive a lot here, but yeah, C. diff. I see this. Talk to me about this.
Yeah, this is a pretty fun sample report, honestly, but basically page one are true pathogens where, somebody has food poisoning type symptoms, et cetera, ate something funky or, start having symptoms like that. And so on the sample report, you can see this patient was positive with C. diff and Yersinia potentially at a borderline, but, symptoms like acute loose stool or vomiting, fever, et cetera, food poisoning organisms. So that's essentially a snapshot of page one.
Hmm. So that's acute stuff. Um, H. pylori, a bit of a
Mm-hmm.
controversial marker, right?
Mm-hmm. Mm-hmm. Yeah,
So,
and this one is tested also in traditional gastro world via a breath test. But
right.
again, having this as a valuable tool to test via stool and looking for not only just the actual marker for H. pylori, but all of its virulence factors. And
Hmm.
again, if we see positive correlations and associations with some of these factors, then higher risk of an H. pylori infection, especially when a patient has those symptoms. So
Yeah.
this is a valuable tool and as you can see, this sample report positive for this patient.
Yeah, very positive here. Um,
Mhm.
and we can treat that naturally. That's a question we get a lot. H. pylori is definitely treatable without antibiotics.
Absolutely. Yeah.
Mhm.
On the bottom of this is the commensal and keystone bacteria. Again, fancy name for probiotics. So if you drew a line down the middle, and you can see a lot of these markers are kind of mixed, but for the most part, depending on, again, relaying it back to patient symptoms and do they need probiotics right now, or do we want to wait to give probiotics? Have
Mhm.
they tried it? So this is where clinical history and getting to know your patient and individualizing care can be valuable.
Yep. Yep. Um, yeah, it's super important to see that because probiotics are always a question, right? Do we need it? Do we
Hmm.
not? And what are low levels? Like, give us information. High levels, give us information. Here are
Yeah.
your dysbiotic bacteria.
Love this page. Yeah. So, we think about the microbiome about just your overall terrain. And when I see a patient walk in with chronic gas and bloating, oftentimes I'll look at this page to see, hey, what's the mix of these opportunistic microbes? Like the name implies, these are microbes that will take the opportunity of an inflamed GI tract or, patient stress, patient has food sensitivities, et cetera. These things will take that opportunity and thrive in the microbiome. So when I see a lot of things detected, especially for chronic bacteria, we'll examine them a little further and treat those things. And if you scroll down a little bit, they also look at chronic yeast and fungus, which this patient has some candida, as you can see, and 2 chronic viruses that have been linked with chronic fatigue syndrome. So it's a nice snapshot of not just bacteria, but we get yeast, viruses. On the next page, we see, 7 parasites, 5 worms, fun times, right? But this patient was clear of those things.
Yeah. And this is was probably my favorite part of the test here, intestinal health markers. So elastase, steatocrit, what was that telling us?
Steatocrit, typically, just as a snapshot, looking at the amount of fat in the stool, is the patient breaking down, absorbing fats properly? Fats are very important, right? Elastase 1 is a pancreatic enzyme. Typically, when trending low, we can give pancreatic enzymes to help with digestion. But again, valuable information for digestive function.
Yep. Beta-glucuronidase, showing us again level of activity of dysbiosis and so forth. Yeah.
Great marker, right? Typically, when this one's elevated, I want to think about, instead of detoxing hormones in a healthy fashion, this enzyme gets in the way of that, and it'll bind hormone metabolites that are trying to leave the body and bring them back in. So sometimes we'll think about, like, for example, a female patient with chronic cysts or fibroids, et cetera. That could be potentially estrogen getting recycled over and over again, and it's just not clearing out. So a lot of cool literature with that marker.
Yeah. The gut hormone connection. We see that a lot in this test. So. And then zonulin. We love zonulin.
Love zonulin. Yeah. Zonulin is the marker for leaky gut. Leaky gut, such a hot term, but now, it's nice to have a marker to test for it. And seeing, hey, is this patient permeable, mildly, moderately, or severe, like this patient, 177, a high zonulin. And again, remember we talked about systemic inflammation. If the patient has acne or joint pain or fatigue or brain fog, that could be linked to this marker.
That's it. Exactly. And treatable. Cool.
Yep.
Well, thank you so much. That was a very quick run through of.
Can talk about it all day, as you know.
We could talk all day. But we're going to wrap it right there. Thank you, Dr. Patel.
You're welcome.